Good evening, everyone.
Good evening.
The Nash County Board of Commissioners would like to welcome everyone here tonight for our recess meeting. It is September 26th at 6 p.m. And the purpose of the meeting is the Opioid Settlement Fund Public Input Meeting. And I hope you'll understand it is a public input meeting. And we will certainly like to hear from those that came here to speak tonight. It is customary for us to begin each one of our meetings with a prayer by a sitting commissioner and a pledge of allegiance to the flag. During the prayer, you're certainly welcome to stand and join us in the prayer. You're certainly welcome to use this time for your own prayer, or you're welcome to use it for a moment of silence, whatever you may have on your heart this afternoon. Tonight, I guess it is. We generally don't meet at night, as you can tell. But this time, I'd like to call on Commissioner Sue Leggett for the invocation, and then Commissioner Wayne Outlaw for the Pledge of Allegiance. Thank you.
Let us pray. Dear Lord, we give thanks for another beautiful day in your creation. As we gather this evening to conduct the business of Nash County, we ask for your divine presence here. May we be good stewards of the resources of Nash County, and we ask that what is done and said here today be pleasing in your sight. Lord, please be with those present here today, the citizens of Nash County, and those who we are working through this project to help. These things we ask in your precious and holy name. Amen.
Amen. Amen. Would you join us in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd certainly like to assure everyone here tonight that this board is very glad to get this process started. We have been, a lot of times we receive funding, and then sometime later before we receive the instructions of how we can spend those fundings. And in Nash County, we like to be sure we do everything correct, and we're very paranoid about that, have a great financial staff that does a great job spending the money like it's supposed to be spent and keeping the Board of Commissioners and the rest of the staff from getting in any trouble when the audits come at the end of a process, which I assure you they will come. Nash County received just shy of $10 million out of this funding that we will receive over the next 18 years. And tonight's process is to start the process of learning how we can best utilize that funding to do the most for the citizens of Nash County that may suffer with any type of addiction in this field. And at this time, I'd like to just turn it over to our County Manager, Stacy Saxler, for the welcome and the purpose of the meeting.
Thank you, and thank you all for coming this evening. I'm sorry I've got my back to you, but I do appreciate your attendance this evening. This is our first of many opportunities to hear from the public about how Nash County should think about spending these opioid settlement funds. And tonight we're going to have a guest speaker from the North Carolina Association of County Commissioners with us to go through the memorandum of agreement that all 100 counties in North Carolina signed for opioid settlement funds. So we'll allow her to provide a presentation to the board, and then we're going to call for comments from those who are here. But I also wanted to share that we have just recently posted a position for an assistant county manager / opioid settlement manager. So we are taking this up into administration where we want to make sure that we are putting Nash County's action plan in place that is very meaningful. And so we are working on hiring a person in that role. So as tonight is your first opportunity to share your thoughts with us, I brought my business cards in here with me, and will be glad to share my contact information with anyone in the audience who would like to email me to kind of get on my list of setting up some meetings with that staff person as soon as we get them on board. I've already been in communication with the hospital, and we're going to make sure that we have that individual meet with the hospital hospital to hear their ideas. And I'll be glad to do that for anyone else who is here this evening that would like to have that opportunity. And I also wanted to just make clear, because we did have a budget retreat, and at that time when I was talking about an assistant county manager, I mentioned using some of the opioid settlement funds to fund that position. And I do want to make it clear to everyone that we are not using those funds to fund this position. This is a county-only funded position, and our opioid settlement funds will be 100% going into providing whatever services we come up with in our action plan here in Nash County to serve Nash County citizens. So at this time, I'd like to introduce to everyone Elizabeth Brewington. Elizabeth is a native North Carolinian who spent most of her life in Greensboro before deciding to explore the Midwest for college. She graduated from the College of Wooster in Ohio, where she received a dual Bachelor of Arts in Psychology and Religious Studies. Prior to joining the North Carolina Association of County Commissioners, she was part of the North Carolina Council of Churches and created the Overdose Crisis, the Faith Community Response Program. She is thrilled to be part of Team County and part of the Opioid Settlement Technical Assistance Team with NCACC. So welcome this evening. Thank you.
Hello, and thank you so much for having me.
Thank you for being here.
So I'm going to just kind of take a step back and give some background on the opioid settlements and just some ground setting on what is allowable in the Memorandum of Agreement. And so, as Stacy mentioned, I am part of the Opioid Settlement Technical Assistance Team. The goal of our team is to improve the health of North Carolina counties and to help counties in planning and strategizing and thinking about the opioid settlement funds. So we are here for you. We are here to help with and provide any technical assistance as they may be. So some ground setting. 11 North Carolinians a day die to an unintentional medication or drug overdose. 8 of those are due to opioids. This is provisional data from the North Carolina Department of Health and Human Services. And from 2000 to 2022, more than 36,000 North Carolinians have died due to a drug overdose. These are really stark statistics, and they're really sad. But also behind these numbers are people's friends and family members and loved ones. And so the goal of these settlements is to abate the harms of the opioid crisis and really turn the tide on these awful trends. Trends in Nash County, the deaths for overdose are currently rising. And so, again, we want to stem the tide. So the national opioid settlements are a bunch of different settlements with different drug manufacturers, distributors, and pharmacies. So there are several different bankruptcies, and then there are 2 waves of payments that are bundled together with manufacturers and distributors and pharmacies. So in total, North Carolina will be getting $1.5 billion with a B dollars over the next 18 years. The guiding principles of these funds are to use the money to save lives, to use evidence and data to guide the spending, to prevent the root causes of the overdose crisis, to focus on equity, and to be transparent and accountable, which is why we are having this meeting today, to try to increase the transparency. So 85% of the funds in North Carolina are going to local governments. This is highly unusual. We are actually the only state in the country doing this. Most states have a much different allocation model, and so it's really special that North Carolina is investing so heavily in local governments, because local governments are feeling the impact of the overdose crisis most acutely. And then 15% of the funds go to the state. Nash County will be getting around $10 million over the next 18 years. The North Carolina or ncopioidsettlement.org has a data dashboard where you can see the money coming in and if any changes were to come to the funds, if, for example, we were to get an increase in funds because of another settlement or things like that. You will notice there is a big spike in this upcoming year. That is because the Walmarts of the world can pay out all of their settlement in 1 year, and some of the other distributors and manufacturers are paying out over 18 years. So the North Carolina Memorandum of Agreement is the document that all 100 counties and 17 municipalities signed on to for the settlements, and it offers 2 different options. These are known as Exhibit A and Exhibit B. I like to call them Option A and Option B. Option A is a list of high-impact strategies that counties can start spending money on at any time. Option B is a longer list of strategies, but it needs to be unlocked by doing a collaborative strategic planning process that is very prescribed and outlined in Exhibit C. Excuse me in advance for the alphabet soup and legalese of the memorandum. It's very confusing, but once you go through that collaborative strategic planning process, you can unlock certain strategies in Exhibit B. The idea is Exhibit A is targeted towards people most directly impacted by the overdose crisis, and Exhibit B is more targeted to the community and is a little bit further out of reach for the people most feeling the crisis today. So these are the 12 high-impact strategies that are listed in Option A, and I'm going to go through and explain each one of them. The first is collaborative strategic planning. This is kind of an a la carte option that a lot of counties are choosing. This is supposed to be very flexible and allow counties the opportunity to do any planning or thinking about how they want to spend these funds. It's helping people reach out to different communities and making sure that input from a diverse group of people is being heard. The second is evidence-based treatment, and in the memorandum of agreement, this is very narrowly defined, the American Society of Addiction Medicine's definition of evidence-based treatment, which is medications for opioid use disorder. And the goal of this strategy is to increase medications for opioid use disorder across all different sectors. Medications for opioid use disorder are methadone, buprenorphine, and naltrexone, or also known as Vivitrol. And these medications are shown to improve patient survival, decrease overdose, decrease illicit opioid use, and overall increase and improve patients' quality of life. Strategies 3, 4, and 5 are recovery support, recovery housing, and employment. All of these kind of fit under the Maslow's hierarchy of needs you learned back in school. It's trying to make sure that people have shelter and a safe place to live, and then make sure we can increase their connections to community and eventually get job security and feeling like they have the ability to get self-actualized. And so all of these strategies are making sure how can we increase connections to community. Recovery housing, a lot of times this could be offering emergency rent, deposits, utilities, trying to keep people in the housing they're already in, or looking at ways to get them into new housing. We're also encouraging counties to think about housing first models, which offer unconditional permanent housing to people who are unhoused. Strategy 5, as I mentioned, is employment related. So these are funding programs related to employment support services for people in treatment or recovery. And these are providing job training or placement or transportation assistance. And one of the things to think about if you want to go through the Strategy 5 option is fair chance hiring ordinances. We know that people who use drugs often have a criminal record, and so thinking about a fair chance hiring ordinance, which would delay somebody having to explain or mark a box about their criminal record and wait till the interview process to allow them to explain their criminal record. And we know that fair chance hiring policies boost income and sales tax. So number 6 on option A is very narrowly defined in early intervention, and it is narrowly defined as helping children who are already showing signs of struggle. And this means children who are already showing up with mental health concerns. We know that in kids, mental health concerns show up first before drug use. And so it's looking at targeting adverse childhood experiences, these things that eventually lead to trauma in a child's life. And so how can we educate the adults around the children about trauma, mental health first aid, youth mental health first aid, and give them connections to care. We know that the more a child has an adverse childhood experience, the more likely they are to develop a substance use disorder or chronic disease. And so trauma is really the gateway to drug use. Number 7 is naloxone distribution. Naloxone or Narcan is the overdose reversal medication and is associated with a 50% drop in overdose fatalities. And so this strategy is making sure that this medication is widely available anywhere and everywhere that a person might need it. Number 8 is a post-overdose response team or a quick response team. These teams we see often with an EMS person and a peer support person or a harm reduction worker. And they go out and they visit somebody who's had a non-fatal overdose in the critical hours between 24 to 72 hours after an overdose and connect people and give them linkages to care and referrals to treatment and other services that person might need. Number 9 is syringe service programs. So syringe service programs have been legalized in North Carolina since July 11th of 2016. And according to the CDC, people who participate in a syringe service program are 5 to 7 times more likely to enter into abstinence-based treatment. They're cost-effective, and the North Carolina Department of Health and Human Services has a wonderful initiative called the Safer Syringe Initiative that helps give people information about the syringe service programs in North Carolina. I like to think of syringe service programs as community health hubs. At their core, they provide sterile supplies to people and naloxone kits, but they also provide referrals to mental health and substance use treatment, HIV testing, overdose prevention, a whole slew of services you can see at the bottom of the screen. And this is a map with all the current syringe service programs in North Carolina and where they serve. Number 10 and 11 and 12 on the strategy list are all focused on justice-involved people. So number 10 is about criminal justice diversion programs. So we know that jail is our most common mental health provider. And so these diversion programs are providing an alternative to incarceration. So either a pre-arrest, a post-arrest, or pre-trial service. The reason this is so important is that a study from UNC released in the last few years showed that somebody leaving prison is 50 times higher to die of an overdose in the first 2 weeks after they leave jail or prison than the general population, and they are 18 times more likely to die in the first year. So it's really important that we are making sure that this population is served. Strategy 11 is very similar to strategy 2. It's working at increasing medications for opioid use disorder in our jails. And recently, the U.S. Department of Justice released guidance saying that if a jail does not allow incoming inmates to continue taking their medication for opioid use disorder, a methadone, a buprenorphine, that detention center would be in violation of the Americans with Disabilities Act. And finally, number 12 on this list is reentry programs. So similar to recovery support services, these are programs to try to connect people leaving jails and prison with social and health services, ways to get them back and connected into the community. So another plug for my team, we provide supportive technical assistance programs, whether that is strategic planning, connecting you to peer counties, collaborating, or even implementing programs. And here are some websites that I mentioned throughout my presentation. The first is the ncopioidsettlement.org, that is also known as CORE-NC, the Community Opioid Resource Engine. It's a lot of acronyms. The Department of Justice has a wonderful resource for all questions related to the legalese behind the Memorandum of Agreement. Our website, the North Carolina Association of County Commissioners, and North Carolina Department of Health and Human Services if you're looking for county-specific data. And then one last plug, we just released the local spending dashboard on the North Carolina opioidsettlement.org website. And this shows what other counties have already authorized spending on which strategies. You can search by strategy, you can search by peer county, and this is going to be updated anytime a county authorizes spending around opioid settlement funds. So you'll be able to see every single dollar of the opioid settlements being tracked. Thank you. I'm happy to take any questions.
Does anybody have any questions?
Let's start with the board first. Go ahead, Mr. Belfield.
You talked about treatment, opioid treatment. In this plan, are you talking about establishing just a place for treating them, or going through the medical centers that are already existing?
It depends on the county. Some are expanding. So for example, they might have a treatment provider in the county, but they'll give funds to make sure the treatment provider expands their hours, so they're open more, or they add another day. Some are thinking about opening a facility. There's not many that are going that route. It's more trying to expand services that are already offered in the county.
And training, and you're talking about spending these funds to train people. And they'd be paid also out of these funds.
What sort of training? Sorry.
I say you train people, and then you hire them, and then it would come out of these funds.
Some counties are hiring like peer support specialists to provide services and helping people get that certification. That's a certification with a person who has been in recovery for a certain amount of time and who is either sometimes placed with emergency medical services or in a hospital and can kind of provide support and walk alongside people.
Well, I asked that question because I've seen programs with grants like that, train people, hire them, and they pay them a pretty good salary out of that, which my thinking is that money ought to go for treatment rather than putting a large amount of it in salaries, because they cut back on the amount of money that you have for treatment.
It is totally up to you as the commissioners. You guys get to decide how this money is going to be spent for your county, and every county is doing it a little bit differently.
Well, I'm sure we'll put a program together, but we want to make sure we're following guidelines and not come up later on saying, well, you didn't do right, so you got to replace that money. You got to put it back.
We are happy to provide guidance every step of the way and review drafts of anything to make sure that doesn't happen.
Any other commissioners have questions for Elizabeth at this time, or any comments?
Go ahead.
Go ahead, Mr. Arrington. Then Mr. Outlaw.
Okay, the county will receive $10 million over, 18 years?
Yes, sir.
That's like $800,000 a year. So would that,
It kind of ebbs and
It's gonna
flows.
fluctuate.
It's front-loaded into the first 3 years, so you'll be getting the majority of the funds in the first 3 years, and then it will slowly peter out over time.
okay. I guess my main question is, how would that be deposited? Will it be like beginning of our budget year, or?
So unfortunately, the National Settlement Administrator and the manufacturers and distributors don't give us a lot of notice when they will be sending the funds, but the payment schedule on that dashboard that I showed earlier is our best guesstimation of when those funds will be coming in. That payment schedule will show how much funds you are getting, period, and so you can plan and know when those funds are generally going to come, but I can't give specific dates. You also do not have to spend the funds in the year you receive them. So you can say, we're only going to spend $400,000 this year and make sure that the funds kind of stay the same for the entire 18 years.
Okay.
Does that answer your question? I know that was a little bit more info.
Pretty much, but like I say, I guess, like I said, when we go through budget, whether we'll know whether all certain amount of funds will be there. So like I said, the committee, everybody can plan on what they can do.
So you already know what funds are in your special revenue account already, and there's kind of estimates of when the other funds will come in.
Okay. Y'all just specific when they would come in. All right. That's it.
Commissioner Outlaw?
Yeah, I got three things that kind of got my attention when you made your presentation. One of your slides said 10 to 20% of people needing help are actually getting that help. Is that by choice, or is there a reason for that?
That's in terms of medications for opioid use disorder. Sometimes that's financial, sometimes that's stigma, sometimes that's just not being able to access it.
Okay.
It's kind of a mix of factors.
Okay. Second thing, you mentioned the housing first model. Can you elaborate on that a little bit?
Yes, so Housing First is the idea to immediately get somebody in permanent supportive housing. So immediately get them in a house, and then eventually work with them to get any referrals or services or treatments they might need, but first to provide them with the housing.
Is somebody in that house to work with them? Or is it just a place where they go at night and that's where they spend their evenings, and then during the day, they do what they do? I mean, I'm just trying to understand
Usually
that.
there's a program element and there's somebody at
Somebody
the
there,
house.
like a house leader, okay. The third thing is you mentioned rapid response teams, EMS rapid response teams.
Yes.
Are they teams that are funded to deal specifically with the opioid issue, or?
So it's been shown a couple different ways. I'm sorry, y'all will probably get annoyed with that response. But it depends. Some counties will fund them as a community paramedics program, and they'll fund a portion of the funds with opioid settlement funds. Because the funds are supposed to go for helping people with opioid use disorder first, and people going out on an EMS call don't necessarily know if they're going to encounter somebody overdosing. The rule of thumb is hopefully 50% of those calls that are answered would be related to opioids, and that's how they could get opioid settlement funding. How we've seen it in other counties is it's usually EMS with a peer support specialist or a harm reductionist. And so when they go and they visit that person, there's somebody with lived experience who can say, hey, I've been in your shoes. Here are some resources that might be able to help.
Well, we've got community paramedics already in the county. So would this be a special hiring of people that would be their only focus to deal with opioid addiction issues?
You could maybe pay for some of that program if they're already responding to a lot of overdose calls, or you could maybe expand the hours of the program and hire somebody. Again, with that kind of program, you don't know who you're going to go out and respond to, but if you have data and say, you know, we're really responding to a lot of overdose calls, then you can spend the opioid settlement funds on that.
So opioid money can be used for salaries that are directed to drug activity?
Yes.
As far as dealing with it?
Yes,
Can all of it be used for that?
it could.
Okay, I'm just trying to understand.
The goal is to any provision of services or delivery of services related to helping people with opioid use disorder. So if that is hiring a person to go help with that, it could be salaries.
There are really no limitations on it in terms of personnel or other type resources.
Correct. You can't charge any, say you're funding an naloxone distribution and you're giving it out to a community nonprofit who would be helping you deliver that medication everywhere. The nonprofit could not charge indirect cost, unlike a grant, but salary and benefits and things like that could also be charged to the opioid settlement funds.
Is there some maximum number of times that a person can receive Narcan before they are required to go into some program?
There is not.
So it's just endless use of Narcan?
The only person who can't recover is a dead person, and so that medication keeps people alive and makes sure they're able to figure out what their next positive step would be.
Do you think there should be some program at some point that would trigger the need to go into a program 5, 10, 15 times?
I've not seen those programs be effective. I've seen people make the decision when they're ready to make the decision. I've not really seen a cap really influence somebody
Yeah.
to stop.
That's just kind of crazy to me. That you would not have some trigger that would move you into a program or some required program. Okay, I'm good.
Other commissioners with questions, comments?
Kind of a follow-up question. Any data where it to be reported to the agency about, you know, how many people were served, what type of service were provided, and all that kind of stuff, so.
Yeah, so every year, there will need to be an annual financial report and an annual impact report reported to Core NC, the opioid settlement dashboard. The annual financial report is, I like to think of as a simple math equation. How much money did you have in your special revenue fund at the start of the year? Did you accrue any interest? Did you send any money out? What was the remaining balance? And so that's just a way to kind of keep track of the funds every year so we know what dollars are being spent. And then the annual impact report is if you send out any funds, you disperse any funds, you give them out, you will report on that. It is a quality measure, an outcome measure, and a population measure, I believe. And you would report on that by strategy. So say you wanted to fund a post-overdose response team, you would say, here's one measure that our post-overdose response team tracked, here's kind of the data they gave us, and then you would share a brief success story, 250 words or so.
Okay, thanks.
Elizabeth, a couple of things. I had in my mind going into this by working with our local Christian Fellowship home for many years, that one of our biggest needs in Eastern North Carolina is the availability of long-term beds for people in recovery. And my experience has been what your insurance allows you to stay or whatever else is funding you to be there, or your own funding, really is pretty short-lived, somewhere between 7, 10, 12 days most of the time. And I just have seen so many people do it over and over, whereas if you get long-term recovery up to 6 months or longer, you have a much better success rate. Are any of the counties that you said have already moved forward with a plan, are any of those trying to join together to create a few long-term beds to have available where there just aren't any? Have you seen that work anywhere, or is anybody headed in that direction?
I've heard talk of it. I don't believe I've seen authorizations put to that yet, just because housing is so expensive.
Right.
There's been a lot of talk of regional approaches that
Right.
is completely allowable under the MOA,
Sure.
but I haven't seen any implemented to date.
Yeah, and that's what it would have to be. It is my belief that it would have to be a regional, at least 5 to 7 or 8, 9 counties, particularly in Eastern North Carolina, where we have smaller populations to do that with. You have done some of these presentations before, I'm sure.
Yes.
In those, are you comfortable taking questions from the audience, and will you work through it that way?
Yes.
Okay. I didn't really know coming into it how you would be doing that. Ms. Saxler, do you want to say anything else before I go that route, or what do you got in your mind? Because this is your meeting.
Well, I mean, we can either ask the audience for questions now, or if you're able to stay with us as members of the audience come to the podium, if there's a way for Elizabeth to participate throughout the evening, that would, I mean, either way is fine.
What's your timeline look like?
I'm here as long as y'all need me.
Okay, that's great. I think that's a good idea.
Okay.
So we'll move in that direction. Do you wish to say anything else first?
I do.
Okay,
So we'll
please
let
do.
Elizabeth sit down, and we will move into the.
Sit down, but don't leave.
Yeah.
I'm here, no worries.
We will move into the item on the agenda for an open discussion. We did receive a statement from former County Manager Z. Lamb, and I'd like to ask Deputy County Manager Jonathan Boone to please read Mr. Lamb's statement.
And I would point out that Mr. Lamb was one of the people that served on the committee to set all this up and decide how the funds would be distributed. He had an incident in his own family and was very much involved in the process of getting us where we are here today. Mr. Boone?
All right, thank you, sir. So again, it's a letter prepared and submitted by former Commissioner County Manager Z. Lamb, and I'll read that for you for the record. Mr. Chairman and members of the Nash County Board of Commissioners, as a member of the NCACC 555 Opioid Working Group, I had planned to attend the public hearing. However, I have been informed that NCACC Executive Director Kevin Leonard and Assistant Executive Director General Counsel Amy Basin will be present. I've been contacted by several counties, both commissioners, and managers about the opioid settlement and have deferred to Kevin and Amy's expertise and encouraged people to refer to the association website and contact Kevin and Amy directly for information. They are truly experts on both the national settlement and the agreement between the NCACC and the North Carolina Department of Justice. They spearheaded the negotiations with the NCDOJ, Department of Justice, and they are responsible for the North Carolina counties getting among the best, if not the best, distribution of settlement funds to counties of any state in America. In February 2016, I initiated the Opioid Working Group, bringing together an interdisciplinary group of Nash County stakeholders. This group, the first in North Carolina, later became the CARE Group and continues today. My interest in forming this collaborative was because of the deadly opioid epidemic that was sweeping Nash County, North Carolina, and our nation. My personal interest in this issue came in full view on January 26, 2017, when my son, Z, died after ingesting fentanyl. I will never be the same emotionally, mentally, or professionally. I had trouble keeping my composure at CARE meetings and therefore stopped attending. While I attempted to provide treatment and support, including residential placement, community resources were lacking back in 2016. Today, thanks to the efforts of community partners, including Trillium and the opioid settlement, more and more resources are becoming available. Unfortunately, deaths from addiction continue to rise. We must use every resource available to address this epidemic. Nash County was one of approximately 30 counties that were non-litigating counties. Only 2 of these counties of the 15-person 555 committee were from non-litigating counties. Some members of the committee initially proposed that the non-litigating counties should receive a smaller share of the settlement proceeds earmarked for North Carolina. Thanks to Kevin Leonard and the NCACC's 100-county commitment, that proposal was dismissed and no set-aside was established for litigating counties. The North Carolina Department of Justice initially proposed a 50-50 split of the settlement funds between the state and counties. NCDOJ balked at giving counties a greater share for fear that counties would commingle the funds in the general fund and they would be used for general health and mental health purposes or for any purpose rather than addressing specifically and head-on the opioid crisis. Thanks to the NCACC and the 555 committee, Kevin and Amy were able to explain to the DOJ that the counties maintain, separate from the general fund, a mechanism known as special revenue funds, specific for non-general fund revenues that come to counties from state, federal, foundation, and other sources. This made quite an impression on DOJ, and the NCACC negotiators were able to realize an 85%, 15% split between the counties and the state. With Nash County receiving only approximately $800,000 per year from the settlement, I urge you to use all possible opioid settlement proceeds to support community programs, treatment programs, and to contract for treatment beds. Trillium is a great partner, and they should be a primary resource for substance misuse initiatives. In addition, more money for inmate addiction programs at the detention center would be money well spent. New inmates often suffer from drug withdrawals, and too often people with substance misuse issues end up for one reason or another in detention centers. We must do more to confront the disease. As I have said to several of you in the past, I stand ready to assist and serve in any capacity as I may be requested to do so. I truly appreciate all the county commissioners have done in recent years to address the opioid crisis. I know your hearts go out to the victims. Victims are not bad people. They do not want to be addicted to drugs. It is a disease. We must do all we can to help people who often cannot help themselves. Thank you.
Thank you, Mr. Bud.
Thank you. And so at this time, I'll invite audience members to come one at a time to the podium if you have some comments that you'd like to share with the board. And when you approach the mic, if you will state your name and address for our clerk to record. And again, I've got my business cards, and I'll be glad to share those with anyone who would like to take that contact information with you this evening so that we can make sure that once we get our staff person on board, we can put you in direct contact with them. So I'll open the floor.
Okay. And if you do come up and you're involved in a group, if you would state the name of the group that you're involved in as well, so we can keep in touch with groups as well as individuals.
Yes, absolutely.
Hello, Commissioners.
Hello, sir.
Hello.
My name's Lewis Johnson. I'm with Open Door Recovery in Bailey, North Carolina. We're a boots-on-the-ground kind of organization. We go out and meet people where they are and try to get them the services that they need. Nash County is so far underserved, and it is getting better, sir, by the way, whoever said that, you. It is getting better, but we're so underserved. When I get phone calls in the middle of the night at 12 o'clock at night and have to go pick somebody up and have to carry them to another county to get them detoxed because we don't have that here. Opioid deaths are rising because of lack of those type facilities. In the 3 years I've been doing this ministry, we've saved 90 people's lives. And when I say lives, they've been sober 2 or more years from opioid use disorder. That I'm very proud of. Another lack of resource for us is housing. It falls on the people like us, the boots on the ground people, to provide homes. We're in the process of opening our first one right now in Nash County. If we can get the planning board to say it's okay, because naturally we run into that too. Everybody wants people to get clean, but not in their neighborhood. We've got a home that will hold 7 men. That's 7 people's lives we can save. Even though I've been doing this ministry for 3 years, I want to put a face to a statistic. This right here is my youngest son, 29 years old. He died on my living room floor the 4th of this month of murder. He was murdered from a drug dealer selling him this poison that's on our streets. I have seen lives ripped apart. I don't want anybody else to have to go through the pain me and this young man here had to go through to watch our child die. Well, I'm trying to pump life into my cold son's body, and I know who murdered him. What if we'd had the money then? What if the boots on the ground had the money then to put people into rehab facilities? Not here, because there aren't any. Rehab facilities out of state, out of Nash County, because we don't have them. I have prayed to God to keep my cool here, and I promise I'm going to do that today. Robbie, I know you well. We've had these discussions in the past, lack of resources. But we talk about them, but nothing ever gets done. Except people like us who go out and get it done. We build the houses. We spend the money. We spend over $50,000 remodeling a home out of our own church budget. How much is the county participating? I don't see the county coming to us and say, y'all doing a great job, let's keep it up, let's buy a couple more properties, one for women. Our next goal is to get one for women. Drugs do not discriminate. And this poison they got on the street today that's killing our people, it's got to stop. And it can't stop at this level. The only way it's going to stop is for people like us to go to these hotels on 301 that are just known drug hotels and pass out Narcan to try to keep people alive. You know who buys that Narcan? We do. We don't get any help from the county. It's like those 301 hotels don't exist. They've been there for years. Everybody knows where they are. But we allow them to operate with impunity, knowing that those people in those hotels are selling poison to our children. I don't understand that. I don't understand why this county hadn't already shut them down. The man that killed my son will be prosecuted if everything goes properly, the tox screen comes back, for death by distribution. That is the harshest charge that a drug dealer can get right now for pushing poison, fentanyl, on our kids and killing them. That's not enough either. If they're selling poison, killing our children, there needs to be a minimum sentence of 50 years in prison. I have done this work tirelessly, so if you want to know where the money needs to be spent, get with me. I can tell each and every one of you where it needs to be spent, because I'm out there with them. I'm saving them. Couldn't save my own son, but I've saved 90 between me and God that was on the road to hell in 3 years. That's only 30 a year, but that's 30 families that does not have to go through what I had to go through on September the 4th, trying to bring my dead son back to life. In my opinion, Nash County is doing a poor job when it comes to fighting any kind of opioid epidemic, a very poor job. Once in a great while, we'll see a big bust where Sheriff Stone gets his picture in the paper and gets a large quantity of drugs off the street. He just got the tip of the iceberg. It's everywhere. I know where the drug houses are. Tell the police, and guess what? They're still operating. Tell me why. Can anybody tell me that? So if anybody really wants to know what to do, you got to get out there where they are. You can't sit up here and talk about it. You got to get into communities like us. You got to set up at events. We got our own canopies, our own tents. We set up sometimes 2 Saturdays. We'll have 2 events booked the same Saturday, giving out information, giving out pamphlets, giving out Narcan, giving out medical lock boxes. You know who pays for that?
Church.
We do, because we care. See, addiction has not hit everybody in this room. I know some in this room that has, but I can promise you this. It will eventually touch your family. It might not be your son, might not be your grandson, might not be your granddaughter, but it's going to get your family. And then maybe you'll take a listen to people like us, the boots on the ground people that are fighting this. And maybe you'll listen to us and let us teach all of those something. I'm just a dumb old country boy from North Carolina, but I know more about addiction, and I know more about treatment. I know about how important it is to put these people off the street into housing than anybody in this room. That I can promise you. So if you want to help the community, you help the small people first. You help the people out here like the CARES Coalition and so many other people that are in this room that's boots on the ground kind of people. And let us help you. We can't do it alone. We can't keep funding these things alone. We can't depend on Hershey grants for $25,000 a year. You know what $25,000 a year does in the addiction world? Puts 2 people in rehab. 2 people in rehab. So you want to make a difference, board? Give it to the small people first. Let us cut the head of the snake off. Let us get them in recovery. Let us help you. That's all I ask. Thank you for letting me share.
Thank you, Mr. Johnson.
Thank you.
Mr. Chairman,
Yes, ma'am.
can we ask questions?
You want to ask 2 questions?
Mr. Johnson,
Mr. Johnson, I have a commissioner that would like to ask you something, sir, if you're okay. And I'm very sorry for your loss. I did hear about that about a week ago. A little bit late finding out.
And Mr. Johnson, I too am sorry for your loss, and I appreciate you coming out here and pouring your heart and soul out. It means a lot. I just have one question. The Open Door Recovery, that's it, right, in Bailey? Mm-hmm. It's part of the Bailey Church of God Family Life, right?
Correct.
So is the Open Door, is that a nonprofit?
503C, yes, ma'am.
It is a 503C.
Yes,
And have
ma'am.
you all ever asked for funding from the commissioners?
We have not. We have got funding in the past from some hard work from the CARES Coalition, who I'm a member of, that was able to get us $25,000 a year for 3 years. $25,000 a year for 3 years, and a $10,000 a year grant for 3 years. So that's $35,000. Have we asked? Every time we tried to call and ask about this opioid settlement, what we're planning on doing, surrounding counties are using the money already. Our county, we couldn't even get a straight answer from the commissioners. Is the money available? Can it be passed down yet? What are we waiting for? Why have we waited 2 years? Why didn't we use that first amount of money when it first came in? Why weren't we prepared when we knew the opioid settlement money was coming?
Well, and the reason I ask that, because we have numerous nonprofits that apply to us for funding, and it doesn't have to be through the opioid funding. That was why
I would love to
wanted
get
to
with
ask.
you on it. See, nobody shared that with me. I've never heard that from anybody.
okay, thank you.
Okay.
Thank you, Mr. Johnson. Good evening.
Good evening, Commissioners. My name is Diane Porter. I'm a resident of Spring Hope, North Carolina. I'm also co-chair for the Executive Committee for CARE Coalition. Louis has an awesome story about the work he does, and he really does work hard. The coalition works very hard, too. We do events as well. We try to educate community. It's hard, though, when you don't have proper funding. But more than that, I want to talk about my experience, because I'm also a peer support specialist. I've been in addiction. I know that world very well. I'm in recovery now, 11 years. The people I work with in hospital, in the area, it just hurts my heart to hear the stories. There's so many barriers when you're talking about people in addiction. Finances, stigma, not really being educated about what's going on with them, because let me assure you, it's not just addiction. There's a second component to addiction, and that's mental health. And you probably didn't know that. When you go through mental crisis at a young age that follow you into adulthood, and you never get treatment or help to understand that, it pushes you to addiction. That's what happened with me. I had a sort of rough childhood. I got pregnant at 16, never had a teenage life. My life was just sort of messed up. And I didn't know, I just thought it was normal. I didn't know it was mental crisis that I went through. So at 31, it led me into addiction. And I hear all the time in my groups a lot of the stories like mine. Not just all young people, you got older people that deal with addiction. And they don't realize that their life before addiction, the trauma, all of the crisis they went through, pushed them towards it. So we need more education. If you've never dealt with addiction in your family, you just don't know. It's not something you can turn on and off just because people say, you don't have to do that. You can stop when you want to. You can't. Your heart might want you to, but you can't. I was addicted for 27 years. I lost my children. I lost everything, but I couldn't stop. And back then, I didn't have all this stuff we have now. treatment centers. Nobody ever told me about that. But that was then. This is now. We need to start treating our people. We need to start educating families so they can help their loved ones in addiction, okay? And I don't mean to be rude with this, but maybe you commissioners need a little education so you can better understand. And I don't say that to be unnice. I just want you to grasp the seriousness of this problem, okay? When you educate yourselves, you can understand better how to use the money that you're going to have to dispense, okay? Also, Lewis is right. The organizations we have in the county that are out here working really hard every day, we need to support them. You know how to say it takes a neighborhood to raise a child? It's going to take a whole county to fight this opioid battle. We need to do it together. And also, like Lewis said, just because you don't have to deal with it in your household today or your family, don't take for granted it's not going to knock one day, because I assure you it will, okay? And it's not always the younger people. Your seniors, a lot of your seniors are becoming addicts. Medication given to a senior when they really don't need it because of pain. That's growing an addict right there. Grandma and grandpa are sitting around every day taking a sip here and a sip there because they're depressed, don't have anybody in the family that wants to take care of them or visit them. That's growing an alcoholic. So never take for granted that this will not knock on your door. Thank you so much for listening.
Ms. Proctor, Ms. Proctor, I want to ask you, Porter, I can't even read my own writing, I'm sorry.
You're fine.
You mentioned the CARES Coalition. Could you talk about it a little bit more? Because I spent some time yesterday trying to identify those people that were involved in that, knowing some older people back. Of course, the chief here at Nashville
Okay.
was very involved at one time, but who is the contact for that now? Or did we have a sign-up group?
Well, my director is Yolanda Adams. Yolanda, would you stand, please? Okay. Davis Green is also connected with our coalition. Like I said, I've been with the coalition now for a little over a year and a half.
Okay.
I started right after I did my apprenticeship there because I graduated from Nash with an associate degree in human service substance abuse.
Sure. Great.
So I love the atmosphere and doing what I did because I started doing groups there. And then I got my peer support and I graduated and I continue to do groups there. But CARE is very active in the community. We had an event scheduled at the Agriculture Center on Saturday, but the weather was so bad, we had to postpone it. So we're hoping to do one either on the 7th or the 21st, I think. I would love if you guys would come and just see what we do. We have providers within our umbrella, so to speak. We do bi-monthly meetings at Nash General Auditorium. And we do a lot of collaboration with our providers to try to find new resources, you know, and extend more help within the county. So,
Okay.
does that answer your question?
You say we had their contact?
Yes,
Okay.
and yes, and I can provide you with
Okay.
the members of CARE.
Sure.
I would be real
does.
delighted. I would be really delighted if any of you would care to come to our bi-monthly meeting. Our next meeting will be November the 7th, and just see what we do. And it's from 3 to 4:30 in the afternoon at the auditorium of Nash General.
Thank you.
Thank you.
Thank you.
We have someone else wishes to speak?
Good evening. My name is Ruth Parker Bellamy, and I am a resident of Nash County. On May 29th, 2021, my daughter passed away from an overdose of opiates that was laced with fentanyl. And I decided at that time, in her memory, I formed Nikki's Total Life Care Center. And since that time, the first thing I did was to educate myself, because my daughter struggled with substance use disorder most of her life. But I didn't have the resources, I didn't get the help. I thought that it was all due to her using drugs, never associated with her having a mental disorder or from trauma in her life. So when she passed away on May 29th, 2021, I decided that I was going to take my greatest pain and turn it into a passion. And so I formed Nikki's Total Life Care Center to educate myself. I got affiliated with CARE. Someone told me about CARE, and I met Yolanda. And I've been attending their meetings. I attend events. But I started, I've never gotten any funding. I did try to apply for grants, was never approved for any. So I even wrote to Josh Stein's office when I found out about the opiate settlement, and I got an email back saying that I should reach out to some representatives. And so I hope that, or assemblies, and I hope that this is one of the things that will help me or give me advice, or somebody can help me along, because since I formed Nikki's Total Life Care Center, I've been purchasing uniforms, school uniforms for elementary school children whose parents are either deceased, in recovery, or incarcerated. I also give care packages, hygiene kits, which I just went out to the homeless shelter, which is close to a park, and delivered some as recently as today. I provided transportation to, after getting calls, for a couple of people who wanted to go into treatment, and I had to refer them to Raleigh. As a matter of fact, I called on Lewis because I met him at the CARE Coalition, and he's been so helpful to me, as well as Yolanda and Diane. So I've been able to learn. I tried to learn as much as I could, every meeting, webinar, or anything that I could go to. Since that time, I've also become a North Carolina peer support specialist. And again, through getting funds as a part of a program that Lewis told me about. I've also become a mental health coach. So I've been really educating myself. I am a retired principal, and this happened in my family. And so it can happen to anybody, as Lewis said. But I've reached out to ask for funding, and again, I got this email back from Josh Stein's office, and so I'm hoping that this is one of the referrals that will help me get some information, because I'd like to build capacity. But it's just really me and my husband right now who we work along. We go out, we go to those hotels, we go by the Piggly Wiggly and Walmart, where there are people who are there who are either going through mental illness or both mental illness and addiction. But I'd like to build the capacity to be able to do that. And so I'm here to find out if there's anybody, because I did go on the website, but it was difficult for me to kind of navigate through that. So I'd like to know if there's anybody, any funding or any help that can be given to someone like me who's out there, and I am out there. I don't have any problems going out to speak, to share my lived experience, or to give, to help someone fill out an application for services. But I personally have not gotten any funds, so I'm hoping that this money that's being given, that some will trickle down, or there'll be some means or ways so that someone like me who's out there can build capacity to be out there even more. Thank you.
Thank you.
Thank you.
Madam Clerk, I'm curious, do we have contact information on these people that are speaking, or
I think they're going to get in touch with me.
they're going to get in touch with you? Okay, okay. So you think you got that covered?
I think so.
Okay, great, thank you.
Yeah.
Good evening.
Good evening.
She forgot to mention that she's had a annual event for Nikki at the Drake Center.
Okay.
Yes,
Right, okay.
to honor her daughter.
Sure.
Hi, I'm Kimberly Hickerson. I stay at 7175 Hunter Ridge Road, Rocky Mount. And I just wanted to contribute to the conversation. I worked in behavioral health for 20-plus years before moving on to early childhood education. And the stories and the experiences that people are sharing just brings to memory all the times and experiences working during that time. And I just urge you to really hear the plea for education about substance use disorders, and make sure you have a real, true knowledge and understanding of what it means to have an addiction, and what it means to recover from that. That recovery is possible and what it looks like, and that people with lived experience, as you make your decisions, should be an active part of your conversation. So not just here, but as you have meetings individually and within the county, you should be including people with this lived experience, people who have done the work and who have been doing this work for many, many years. It's a perspective that you won't have otherwise as you make those decisions. I know as I'm sitting here and looking at the people in the room, there are many nonprofits, other different individuals in the community that are doing this work, that have homes for men and women that are entering from reentry or coming back into after incarceration that aren't here. And they just weren't aware. I'm texting them as I'm here. They just weren't aware that you're meeting. I heard you say that you're having other meetings, and that's wonderful. So I'll make sure to share it with the people I know next time, and make sure they're aware of that. But also when the gentleman spoke about Trillium, and they have a Nash County Collaborative. I don't know if you know or are aware that they do meet regularly. And if you're going and someone's doing presentations at those meetings, those individual meetings, not just these kind of settings that are here tonight, but really making sure that you get out and hear the voices of people that are working in the community doing this work, but not just in terms of treatment and the direct services, but kind of those wraparound services. At Downey's Partnership for Children, we work with families. We hear the struggles of families. We know those kind of, we call them protective factors, things that we put into place to kind of help them, support them, so that they don't encounter difficulties with addiction or that may lead to abuse or neglect of children and different issues. So we get a really kind of, again, a boots on the ground perspective of some of those factors that people are experiencing that might contribute to addiction. So there are many different voices that could be at the table as a part of this conversation, and I just urge you to make sure you're taking the time and being very deliberate about engaging with all of those different people before making decisions about how to utilize the funds. And so that's the only thing I wanted to contribute to the conversation, but just let you know, there are many people that aren't in the room today, and to take that time to do that. I had a question for you. You did a very great, it was a wonderful presentation. Do you do or offer education for the counties that you work with?
We do. So we provide education on specific strategies. We provide education around kind of the more technical legalese of the memorandum agreement. We also help counties if they want to do like a request for proposal process. We can help them figure out what the best way to do things like that.
Okay. Do you help with the education just about addiction or substance use disorders? And
we do, and we also connect to community partners who can help with that as well.
yeah.
The NC Opioid Settlement website has information on strategies and kind of does a deep dive on each of the different ones and has some background on substance use disorder on all of those.
Okay. All right, so that's all. I was just curious about those things. There's some great people in Raleigh doing work also that we worked with a lot when I worked at East Point with recovery. There's some really great, well-informed people throughout the state, as well as locally, of course, that can contribute to the conversation. So thank you for your time.
Thank you, Kim.
Thank you.
Go ahead.
Hi, my name's Adrienne Williams. I am the former Empowering Youth and Families Program Assistant. I worked with Sandy Hall at Extension, and this program was a prevention program. And I'm kind of piggybacking what she's saying. When you do create your plan for this county, I'm sorry I didn't tell you where I live. I live in Zebulon, right on the line.
Okay.
So when you do create your plan, please make room for prevention, for education for children. Our program spoke to parents and children, and we educated them about preventive factors, resilience, ACEs, all those things that people have mentioned that have affected the population that is using. We talk to people who aren't using. It was the hope, or is the hope of the program, that you can curb the numbers by preventing people from using. Everybody doesn't have to fall ill to this disease, and we need to educate our community about what is going on. Drug dealers, they groom children, and it's in our schools, and if the children don't know how to say no, they're going to fall ill to this. They're going to take it home, or we're going to lose small children before they even have a chance to thrive. The families that have come to our program have, those kids are thriving, and they understand what it is to serve community, what it is to protect themselves and to protect their family. The adults were taught what to look for, or we had conversation about communicating with each other and watching different things that were happening in their home. You have people who can come into your home that you trust, and they use that trust against you to take a grandparent's medication. And that may be where it starts. It doesn't have to start with a drug dealer who is some eerie person standing behind a corner. It could be right out of your home that these things could begin to happen. And we talked about paying attention and protecting our families and protecting our community. Once they graduated from this program, they would go out, we would share information with everyone. It was their goal and it was their task to talk to others and figure out how you could help. So when you do create your plan, please include, and there's room, I've read the MOA, there's room in there for prevention. It is not a linear thing that is just, we're going to do harm reduction. It is a circle, and everybody needs to be included in the circle.
Thank you.
And I did have a question for Ms. Elizabeth. You indicated, well, you stated that you would help with collaboration. I think there was a lot of things going on. And then you also said implement a plan. Did that mean, I believe that this county is going to come up with a plan, but did that mean if the county does not, do you all implement something so that the money is spent? Okay, because when you said implement, I thought that would be short, absent anybody else's input, and I wanted some clarity.
No, each county is responsible for deciding how they want to spend the funds. We are just advisors, and
Okay.
so we have no impact on how the funds get spent. We can just advise and provide guidance and kind of translate them in a way.
Oh, and I'm also the co-chair of the CARE Coalition. I forgot all about that, and I came to them. They'll be mad at me when I sit down. I came to them to find partnership, and I did, and to grow outreach for the program that I was working on. But again, I'll probably say it over and over again, please include prevention for families and children, because that's where it's going to start, and that's how we're going to get these numbers down, because at the end of 18 years, you do not want to be worse off than where you are now.
Adrian, I assure you that Nash County is going to come up with a plan.
Oh, I believe so.
Okay, thank you.
Thank you.
Darrell, why don't you come on up, sir?
Thank you, sir. Okay, good evening, folks, commissioners. I'm Darrell Mitchell, and I'm a ministry leader for Celebrate Recovery program at Midpoint Church down in southern Nash County. In fact, Mr. Johnson was one of my leaders at our Celebrate Recovery program before he started his program at Bailey for Open Door. Couple questions. Can we get a copy of that presentation? Is that possible? Okay. And number two, is there any stipulations of the money going to churches or any nonprofits? Is there any restrictions, I guess I might say?
No restrictions, no.
Okay. Okay, all right. So the fact that my Celebrate Recovery as Open Door Recovery is a faith-based recovery program. If you'd have told me 10 years ago I'd be involved with a recovery program, I'd probably question your sanity. But I've learned to love those people. I found out I've never had a problem with addictions, but I am one of those people. But what I found out is, I've never really had problems with addictions, but I found out, God has a sense of humor. He starts dropping young people in my life. First one I encountered is a friend at work, and his son was involved in intervention. If you've ever been involved in intervention, there's nothing more, I don't know, I saw evil in that house that day, and it was just a terrible, terrible situation. And this guy started dropping these young men in my life, just out of nowhere. All of them had been in 20-something, dropped out of school, got hooked with the wrong crowd, started drinking, and then it was a gateway to something else. And every one of them ended up in jail somewhere, some county. One of them was so bad, he knew which jail was better than which county, and that's how bad it was. But I was reminded what, in my Celebrate Recovery program, we've been going now for 4 years, and you know, in the recovery, we're not quite like Open Door. We don't go out to the hotels and trying to find all this. That's not our thing. It was once you decide you want to quit, and there's got to be, if you ever go through a recovery program, the first step is denial, that you have a problem. And I was reminded, I don't know if you've seen the movie lately, the Jesus Revolution. I'm old enough to remember that generation back in the 60s where people just did drugs just to be rebellious. And that time, it's reminded me of this time today again. It's almost like it's come full circle. I questioned, I said, what's the difference? I remember in the 60s, our family unit was pretty good intact. Today, you look around and the family unit's destroyed. It's gone. And so I have people that come in our Celebrate Recovery program on a weekly basis to give her testimony. And just about everyone to a person. Had a young lady come in last week, and her first statement was, my mother left home. My mother left home, so my dad remarried. My stepmother abused me, and my mother didn't want me. So guess what happened to her? She started down this road of addictions. What is Celebrate Recovery is a faith-based program that once you decide you want to recover, you've decided you want to quit what you're doing, then we walk beside you. I heard you can actually download the app on your phone. Celebrate Recovery is one of the first sermons I heard was Celebrate Recovery is a faith-based, Christ-centered program that helps you get through, get some freedom from your fill in the blank. And a lot of times these drugs and addictions, I don't think it was like this back in the 60s where you just want to be rebellious. A lot of times their drugs and alcohol are because they're hurting in here. And the drugs and alcohol are just Band-Aids for that hurt, the pain that's going on inside of them. So I hope part of the plan can be, because faith-based recovery programs work. I don't see other programs that give you look at the statistics. Faith-based recovery programs, the percentage of people recovering is double, triple what a non-faith-based program. So I hope those monies can go, because we see them all along. They'll come in and they need some help. If they're on drugs right there, we can't help them right there, okay? Because we have a small group every week, and you can discuss that stuff. Well, one of our guidelines is we're there to hear from you. We're not there to fix you, because we can't fix you in an hour. You know, we can't fix you in 30 minutes, an hour, whatever. You need some help. And we see them, but we don't have a way to. I think there's one faith-based house in Tarboro, there's one down east, there's one out west, but there's nothing local that they can go into and really get some help. Then once they've decided they want to get help, then they can come back to us and say, look, now I need some discipleship, I need some guidance, I need some friends who've been through the same thing that I've been through. And you can walk beside them and watch them and give them that accountability partner, that sponsor who can, hey, call you up. Hey, I'm going by my drug dealer to get some drugs tonight. No, don't do that. That's what we're there for. That's how you prevent, I look at the family unit, and that's just, again, they're not getting in the home. So they're having to go out and find stuff that makes them, I guess, feel like someone does love them. And I see it more and more every day. People that come in there and they're ashamed. Again, we talk about those people because a lot of times even churches don't want those people in their churches because they think they're druggies or is alcoholic or whatever, and so they kind of look at them funny, look different. But I've come to love those people because without the grace of God, I could be one of those people. I could be there myself. So I hope that as we make a plan, that we can include, some money. If I see a person, that's struggling, he's trying to recover, but wow, he falls off the wagon and needs to go to a rehab or something, that I can be able to point some money to him to get, because a lot of times they can go, but they don't have the money to go. And so that's all I have to say. We've done this recovery program for 4 years now, and one of the best ministers I've ever been involved with. I was happy doing life, as a chaplain with the Mudcats and all that stuff. I even ran for commissioner, and so I was happy doing life, and God threw this in my life, and it's been the most worthwhile ministry I've ever been involved in. So thank you for your time, and I hope that it's not a silver bullet for this problem. It's not a silver bullet. We can't say one thing will solve this problem. It's going to take all of us to do that. Education. But just getting people, I heard more often than anything is, I just want to be loved. That's all we do. We just tell people, we're not going to judge you. We're just going to love on you. Let people know, let you know we love you. So thank you for your time. All right. Thank you so much.
Thank you, Darrell. We have other speakers that wish to come up or questions by anyone? Good evening, ma'am.
Good evening. My name is Nikki Joyner. I am a resident of Nashville, North Carolina. I also am the Community Paramedic Program Coordinator for Nash County EMS.
Right.
I have been with that program since it started in 2015, and over the years, we have refocused our priority to overdose patients. Trillium does give us nasal Narcan to hand out post-overdose. Right now, all of our quick response vehicles has the Narcan, and they give that out along with mobile crisis information and one of the community paramedic business cards. What we try to do then is to follow up with those patients, which it has been difficult since I have took over this position. We only have 3 of us right now. We're working the 24/72. We still have 1 position open, but I do have goals that I would like to see for our community paramedic program. The commissioners have already funded our program, so our salaries are taken care of. What I would like to see is Suboxone in the field where we start that medication-assisted treatment and then fill in those gaps of the healthcare to get them in with recovery resources. Any questions about any of that?
Thank you.
Thank you.
Thank you.
Others?
Next step.
Okay, that was our open discussions as it is on the agenda, and it was very open, as you all could see, and the board greatly appreciates each one of you coming forward, being willing to talk to us about what you do. That's what we're looking. And I do want to apologize for us being perceived as being slow getting this started. It is obvious that we could indeed be a little slow getting it started, but I promise you that we will catch up pretty quickly. We're going to put the resources and have people in place. Nash County's had a lot going on the last year, quite frankly, and it's taken quite a bit of our administrative time, but that's no excuse. This is very important. And I personally am very sensitive to this particular thing. Those that know me well know I have a son that's 44 years old, that had an addiction problem for many, many years. He spent 16 years fighting it, and it took he and I a long time to understand what his real issue was mental health issues as it relates to panic and anxiety attacks, and medicine just helped him get through those times, and when the medicine didn't work, he'd always go back to some other kind of drug, his drug of pleasure. I think none of them are good, but his was alcohol, and believe me, he created a heck of a mess. Keystone knows how big of a mess he created, but I'm one of the fortunate ones. Quite frankly, because he created such a mess, he got a long prison term. He actually served prison 3 times. The last time was a 15-year sentence because he got under the Career Criminal Act, in which he served 9 years. But prior to going in, he had already mastered his addiction problem, but the mess still had to be cleaned up that he was in. He told me many times, Dad, you don't need to worry about me. I've got to get squared up. I did all this stuff, and it's just time to do that. He was fortunate to get out somewhat early through a COVID compassionate release, and immediately went in a job in Charlotte that he had lined up when he got out. And it's so important, and I hope we'll do some things with this money to help those that are coming out of prison or maybe even our own jail to have a stable point, because many people are not like Ben. He had a stable family. He had family that stood behind him the whole time, but also he had a place to go that made him worthy, and he works for a recovery home in Charlotte called Safety Net. He has recently been made the director of the Charlotte operation after 30 months been out of prison, and he keeps 24 people in that facility, and but he's one of the fortunate ones. That it didn't happen many times. So I just say that to let you know that I understand what each one of you said. Our family lived with it for a very long time, but I do also understand we were one of the fortunate ones that doesn't always turn out that way. So on the agenda, the next step, I'm going to call on our county manager to give us our next steps here, and we sure appreciate your patience in working with us. It's going to take us just a little bit longer to get this wagon loaded, but we will do it. We'll put what resources needs to be there, and Stacey, I'll let you take it from there.
Okay, thank you. Yes, thank you all very much for your attendance this evening, and for those of you who shared your stories. This meeting is being recorded, so know that when we do get our staff member on board, they will certainly be exposed to the meeting tonight and the things that you brought to our attention. And the presentation that Elizabeth shared with us this evening, I think I can share that. So I'll be sharing that with board members as well as the CARE Coalition, that email group, anybody that I reached out to via email to invite to this meeting this evening. I will send it out, and then you are welcome to share it with those in your circles as well. So I just want to thank you again. I will keep in touch with Yolanda with the coalition and the hospital and make sure that they know when we have somebody on board. And for those of you who got my card, and for those of you who haven't gotten my card, I will give that to you this evening. So please reach out and let me know that you'd like to have a one-on-one with that staff member as soon as we get them on board. And I believe my timing on that at this point, I'm trying to think of where we are. September has left us, hasn't it?
Not quite, but getting close to it.
Right, so I would hope within another month or so, 6 weeks, we'll definitely have somebody on board working in this arena, and we will get Nash County's action plan moving along. So thank you all again for your time this evening.
Commissioners, any closing comments?
Oh, I would just
Ms. Bell?
like to suggest to county manager, as we move into that plan, involve these agencies that came tonight to
Absolutely.
talk about it.
Absolutely.
And let them have input.
Others? Well, on behalf of the board, I want to thank each and every one of you again tonight for being here. And if there's no further comments, I will call for a motion for adjournment.
So moved.
Moved by Commissioner Wilson, is there a second? Second by Commissioner Belfield. Questions on that motion? Seeing none, all in favor of the motion, let it be known by saying aye. Aye. Any opposed by a like sign? We stand adjourned. Thank y'all.